So we have support at home, children's continuing healthcare from a parent perspective. Please note that this is not intended to replace any medical advice, legal advice or otherwise. It's just from a parent's perspective. What is continuing healthcare? A continuing care package will be required when a child or young person has needs arising from a disability, accident or illness that cannot be met by existing universal or specialist services alone. That's taken directly from the National Framework for Children and Young People's Continuing Care. Now, examples of continuing care packages could include respite, care at home, and other services. So how does one apply for continuing healthcare? Any health professional can send what's known as a pre-assessment or a referral to your local integrated care board, formerly known as CCGs or clinical commissioning groups, now known as ICBs or integrated care boards. It should ideally be a health professional that knows your child and knows their needs well and who has previously done an assessment, but that's not a requirement. Any health professional can send one. Sometimes, as required as part of a pre-assessment, there is a checklist. This isn't always the case and it's not always needed. The next step, if your ICB then agrees to carry out an assessment on your child following a pre-assessment or a referral, according to the Children's Continuing Healthcare Framework, which is the legislative piece that guides continuing care, the assessment is based on 4 areas: the preferences of the young child or person and their family, a holistic assessment of needs of the child or young person and their family, reports and risk assessments from a multidisciplinary team or evidence collated during the educational health and care plan assessment, and the decision support tool for children and young people. The DST, or what's otherwise known as the decision support tool. So even though the framework sets out the 4 areas, typically the decision support tool is the greatest area where concentration is placed on for assessing the needs of a child and whether they are entitled to continuing care. What's known as an MDT, or a multidisciplinary team meeting will take place, and during this meeting, any professional, whether it's health, social, educational, will then vote against each of the domains of the decision support tool. There are 10 care domains within this decision support tool, and we'll go through them in a moment. Each domain has descriptors describing the level of need in each domain, and you need to decide what level of need your child has against those descriptors. So, as I said, each domain will have a scoring, and I'll go through the scoring in a minute, but these are the domains. You have breathing, eating and drinking, mobility, continence and elimination, skin tissue and viability, communication, drug therapies and medicines, psychological and emotional needs, seizures and challenging behaviour. The levels of each domain, as I said, are put against descriptors in each domain. And each domain then, once you've decided which descriptors fit your child, will have a level. You have no additional needs, low needs, moderate needs, high needs, severe needs, and priority needs. Not every domain will have a priority level, but they all have no to severe. We're going to take a look at one of the domains just as an example for you. And you can see here I've chosen eating and drinking. And you will note that I've said here is that the DST for each ICB will differ very, very slightly, but the descriptors and the levels should remain the same. And I'll just give you an example. So for moderate level of need, needs feeding to ensure safe and adequate intake of food, feeding, including liquidized feed, is lengthy, specialized feeding plan developed by speech and language therapist, or unable to take sufficient food and drink by mouth, with most nutritional requirements taken by artificial means, for example, via a non-problematic tube feeding device, including nasogastric tubes. We then go on and up a level. So for example, in the high level of need, you have a few options here. Faltering growth, despite following a specialised feeding plan, a speech and devised by a speech and language therapist and or dietitian to manage a nutritional status. Or, and the key word being or, so you don't need to tick each of these levels, it's or. So you don't need both dysphagia and faltering growth. You only need one or the other to meet a high level in that category. How to prepare for an MDT assessment and a DST, hints and tips. Read the decision support tool and decide which status or which level of need your child meets in each category. You will need to gather a full list of all health professionals, social professionals, educational professionals, or anyone who has involvement with your child and experience of meeting their daily needs or deals with them in some way that they know how their needs work. You will need to gather evidence and more evidence to support your application. And this will include everything from prescriptions from your pharmacy, the prescription documents, any letters from your consultants, your dietitian, your speech and language, any of your community professionals, health professionals, your nursery, your educational setting, the carer, your granny, your mum who minds your child on a regular basis, anybody. You need to gather as much evidence to back up what you're saying is the level of need for your particular child. Write a 24-hour care diary and your views and wishes. Check in regularly with the assessor, the nurse assessor who's carrying out the MDT, to make sure that they have all the evidence and they've gathered, and see who is actually attending your MDT. And have a conversation with the relevant professionals to make sure you are on the same page regarding the levels of need. After the assessment has taken place, the assessor will then present findings to a panel. This panel, again, is an MDT panel or a multidisciplinary panel. And this will include health allocation, social allocation, local authority. It'll include a lot of people. And they will make a decision based on the DST and the evidence put forward. Once the panel has made a decision, they will contact you to let you know. If successful, they will also let you know the package of care that they've decided or awarded for your child. The package will vary accordingly to the needs, so there's no one suitable package for one child or etc. It's all different. If unsuccessful, you can lodge an appeal and you can ask for a copy of the decisions made in the DST by the panel and why they've decided not to award your child continuing care. However, please note that each ICB has their own complaint process, so they will all be slightly different. And it's important that you engage with them throughout to follow their complaint process. So some tips taken directly from the framework. Make sure you read the framework before applying. It will help you navigate the assessment better. Read, and read. I think it's something like a 50-page document, and it's well worth a read if you are applying for continuing healthcare. Familiarise yourself with the language of the framework: DST, Decision Support Tool, MDT, Domain, Level of Need. Ask any professional, make sure that they familiarise themselves with the framework and assessment process. A lot of professionals don't actually know, and they might not know, so it's good to give them the guidance as well. During the assessment, try and stick to medical facts and speak about the child's needs being met and unmet, rather than your own feelings and views or how it impacts on you. It's a very hard ask, and it can become emotional. And you can always ask someone to attend alongside you if you find this difficult, or if you find it to be a difficult process. Key phrases taken directly from the framework. So these are a few phrases that I've picked out of the framework directly. So they are quotes, but I think it's interesting to note how the framework guides us around continuing healthcare. And the thing is, they place so much emphasis on the DST that sometimes these points are forgotten. So the nominated children and young people's health assessors will use their clinical skill, expertise and evidence-based professional judgment to consider what for each care domain is over and above what would be expected for a child or young person of that age. So over and above what's expected for the child of that age is the key phrase there. So when you're collating evidence, that's where you need to point your evidence to. The tool may not always adequately describe every child or young person and their family circumstances. Professional judgment and clinical reasoning are paramount to ensure that a child or young person's needs are accurately assessed, taken into account, given due weight, and when making a decision regarding their continuing care needs. All 4 parts of the assessment process interact in defining the child or young person's overall need for continuing care. So that's a really important point, is that if you say to your assessor, actually I think this hasn't been captured in the DST, well, you can say, well, actually you need to consider it anyway as part of the other 4 parts that are deemed required. There may be circumstances where a young child or young person may have particular needs which do not fall within the 10 care domains described in the tool. For example, a child who is unable to regulate their body temperature or who has an unstable cardiac condition. So information in these needs should, of course, be included as evidence. So again, that's the same point. If it's not in the DST, that does not mean you can't supply evidence for that need. And the assessor will need to take into account that it doesn't fall within the domains. The assessment of level need must recognise where a child or young person requires constant supervision or care, which is largely provided by family members. There will be a need for professional support to allow the family time off for their caring responsibilities. And this may require a social care assessment and agreement between the ICB and their local authority. So the social and the local authority and the ICB have a duty to interact with each other, but the key phrase there is that families need time off from their caring responsibilities, and that should be noted during assessment as well. There's also a part about rare and genetic conditions. So there is cases where there'll be a lack of definitive clinical diagnosis, but this doesn't matter. The assessment's based on needs, not a diagnosis. So you don't need a diagnosis to assess their needs. And I suppose it is important to know just by diagnosis of a particular disease does not mean they have a need for continuing care. The same is true the other way. The tool is not standalone, so that's in relation to the decision support tool. And they need to have worked alongside the MDT and any key professionals that you invite to that assessment to understand the needs of that child. That's very important, because it's not just health, it's also social, it's also educational, it's also therapies, it's also your family, siblings, your wider community. Everybody's affected by the care of the child, so they all need to understand that their voice and evidence is used in the assessment. A final note, a pass mark. It's not a pass mark, okay? It's a child is likely to have continuing care needs if assessed as having severe or priority level of need in at least one domain, or being the key word there, or a high level of need in 3 domains of care. That's not always guaranteed, okay? So even if you get 3 scores of highs in your domains, that does not mean you will get a continuing care package alone. There is other factors. It's not guaranteed. And again, likely being the key word there. However, it's in the framework, it's part of the guidance, and, you know, it could be said to an assessor, well, actually, I think we've met criteria here. Can you please have another look? So, continuing care and other services, as I've said, kind of continuing throughout the presentation, should interact. They don't always, okay? And there is a duty on them to interact and kind of sort out together a care of package. Sometimes social and the local authority are involved, sometimes they're not. But there is guidance in it in the framework. So again, this is from a parent perspective. So this is not to replace any legal or medical opinion, but thank you very much, and I hope it was useful.
Thank you, Sarah. We'll ask this one, Dr. Geary. Who can head an MDT if required?
It can be any clinician who knows the child well. Yeah, and it can be, in fact, a children's nurse, community nurse, if that child knows, you know, that clinician knows that child well. Yeah.
Got another one. What steps are being taken to ensure awareness in local communities?
Can I pass it to you about this condition?
Yes, I think it's come from a family.
Okay. I'm a manager for a health visiting service and school nursing service. So the awareness is all our staff are trained nurses and midwives by background, so they will have awareness of the condition. But what I would ask you to do, speak to your health visitor or your school nurse about the condition and raise that awareness and the needs that you have. And make a plan, because we work in partnership with families. We see all children in our communities. All children have a health visitor, so the expertise don't often sit with us. It's within the medical team, as the colleagues from Great Ormond Street have explained earlier. So you need to raise that awareness, but by us attending these events and engaging with the charity, we'll take that back to our workforce and raise that internally as well. So that's what we do in the area where we work. Dr. Geary and I work in part of London in Tower Hamlets, so we will certainly raise that and within our own kind of workforce there. So all areas are slightly different. So I think we all need to be raising awareness together. So you're part of that. Speak to your professionals that are involved in your care, your health visitor, your school nurse, anyone really, and say and raise their awareness and ask them what can we do locally. We like to do, as the term is, co-production, so help design the services, go into parent carer panels, and send feedback. So all organisations all healthcare organisations collect for service user feedback. So raise that awareness through these service user feedbacks and offer your commitment to parent user panels to design these services.
The one last one that's quite interesting is, where would family find support for psychology and community? Where would a family, where would they start looking? You know, if I was a family, would you start on Google? Would you start on Facebook? Where would you say the best places for families to start?
Yeah.
So as a health visitor, as I said, I have a little talk later about the role of the health visitor, how you can contact your health visitor. Each family in the UK with a child under 5 has a health visitor as a universal service. That's a really good starting point. If you haven't seen your health visitor or you don't know how to contact them, you could look in your red book. You should have been given a red book when your baby was born. Often there's the contact details are in the front of the red book. Google is a good place. Talk to your health visitor. They know the community and where to get help. They can make referrals and they're supporting the whole family. So psychology, you said it might affect parents. It's a stressful time like we heard. You might have your own needs. So health visitors can give support, but also can refer on to more specialist support if that's required. Also to children, child and adolescent mental health services if that's needed, if your child is affected, if you have an older child. So do get in touch with your health visitor, or if they're over 5, with your school nurse and ask for that support. You can also look at each local authority in the UK has a local offer. So Google the local offer. That's where it's set out what each local authority commitment to support children with special educational needs and disabilities, and there are lots of links to different services that are local to you. So that's always a good one. Local offer, and you should find it.